The role of the U.S. government in the healthcare system. Is healthcare a right or a privilege? Despite the fact that all the citizens of the United States have constitutionally guaranteed rights to life, freedom, and safety, many of those who are sick or disabled cannot enjoy these rights. Millions of Americans cannot afford even basic medical care, either for themselves or for their elderly parents and small children. Under these conditions, it is next to impossible for them to build a lasting career, have a family, or pursue happiness. It seems reasonable, as one approach to resolving these problems, to make healthcare a human right. However, many politicians, both libertarians and conservatives, believe that this idea contradicts the principle of the free market, since most individuals receive insurance through their jobs. If everyone was entitled to free healthcare services, it might mean that no one would prioritize finding a job. Thus, the healthcare system of today is based neither on rights nor on privileges. The first option is impossible, since healthcare is far from being affordable to everyone, whereas the second is only partially true, as it does not depend on an individual's status but rather on professional competence, allowing a person to find a job that provides social and healthcare guarantees. The role of the government in healthcare, the ACA. The government produces a direct impact on healthcare, since it decides what policies and regulations will guide care delivery in various medical institutions. Still, discussions are taking place regarding the particular functions the government must perform in relation to healthcare. 10 major roles are typically cited. Purchasing healthcare. Providing healthcare. Guaranteeing access to care for the entire population. Controlling healthcare markets. Fostering knowledge acquisition. Developing healthcare technologies and new medical practices. Ensuring adherence to quality standards. Informing decision-makers. Developing the workforce. Convening all the stakeholders involved in healthcare provision. The Affordable Care Act, ACA, introduced on March 23, 2010, was aimed at providing access to health care for citizens who had no insurance coverage owing to their low income level. With the signing of the act by the President, the role of public health has attained unprecedented significance, since it has brought about drastic changes in all aspects, including services, quality, funding, and technology. Besides allowing the government to improve access to healthcare services by expanding insurance options, the Act also provided many more people with the opportunity to undergo health-related screenings and use free preventive services, including vaccinations, blood pressure measuring, cancer examination, etc. Ethical issues affecting healthcare delivery. The paper analyzed concerns the present-day problems in healthcare, including ethical issues among others. Even though healthcare reform in the United States was initially aimed at providing wider coverage, the system is far from being fully universalized. Since resources are scarce, illegal immigrants cannot be properly accommodated. This creates an ethical dilemma. Healthcare units are forced to choose between providing universal access to their services or prioritizing citizens and legal immigrants. Denying access to illegal immigrants would mean fostering the spread of disease. At the same time, it would allow for saving funds that can be allocated for prevention. Furthermore, the article increased my understanding of the influence of ethics debate on privacy issues. Since the popularity of technological innovations in healthcare is on the rise, it is now easier to share photos and videos of patients with those who are not involved in the process of treatment, a practice that is unethical. Thus, reforms are required for healthcare units to be able to eliminate unethical practices.